So if my dog has Addison's disease, will he die?
Addison's disease in dogs? Get out of here! Addison's disease is a very uncommon disease caused by partial or complete failure of the outer layer of the adrenal gland. The adrenal gland produces hormones that controls many of the body's functions. In Addison's disease, there is a chronic deficiency of cortisol, aldosterone, and adrenal androgens. When the body is deficient in these hormones, it can cause a high level of potassium and a low level of salt, causing an electrolyte imbalance in the body.
One of the main causes of Addison's disease is the direct result of injury to tissue due to hemorrhage, infection, or certain autoimmune disorders. Also, another reason may be if the dog has been on long-term steroid use and they're suddenly withdrawn from them. Finally, the onset of Addison's disease could have something to do with the pituitary gland in the brain. Addison's disease occurs when the adrenal glands don't produce enough of the hormone cortisol, or in some cases, even the hormone aldosterone. That's why you may hear this disease referred to as chronic adrenal insufficiency, or hypocortisolism.
Cortisol is produced by adrenal glands, just above the kidney. The class of hormone this belongs to affects almost every organ and tissue in the body. Scientists believe that cortisol has hundreds of effects in the body. Cortisol's most important job is to help the body respond to stress. Among its other vital tasks, cortisol helps maintain blood pressure and cardiovascular function, slow the immune system's inflammatory response, balance the effect of insulin in breaking down sugar for energy, and regulate metabolism of protein, carbohydrates, and fat.
Addison's disease most commonly affects young to middle-aged female dogs. The average age is 4 to 5 years old. The clinical signs at first can be vague and non-specific. They could include vomiting and weight loss, periodic episodes of diarrhea, increased thirst and urination, as well as intermittent shaking episodes. It's easy to see with clinical signs like this why Addison's disease is often misdiagnosed.
When a pet is stressed, the adrenal glands produce the hormone cortisol, which helps them deal with the stress. A pet with Addison's disease cannot produce enough cortisol, so the clinical signs may worsen.
Sometimes the disease may take on a more serious form. There could be sudden diarrhea, vomiting, weakness, and the dog may even collapse. This is what is referred to as an Addisonian crisis. In a circumstance like this, urgent hospitalization is needed.
On examination of dogs with Addison's disease, one might see depression, weakness, dehydration, and sometimes a slow, irregular heartbeat. A physical exam, history, and some initial lab tests will help confirm the suspicion of Addison's disease, but only an ACTH challenge will prove that. Sick dogs often show a change of pattern in their white blood cells. This is called a stress leukogram. The changes in the white blood cells are often caused by cortisol. In case of an absence of the stress leukogram, that might be a clue to consider Addison's disease.
There are 2 stages of treatment for Addison's disease: in-hospital treatment and long-term treatment. Long-term treatment involves the administration of hormones in one of 2 ways. We have the option of a daily pill or to give an injection once every 25 days. It's important to note, however, with Addison's disease, stress plays a crucial role and should be minimized whenever possible. In times when stress just can't be avoided, like surgery, boarding, travel, you may have to give extra hormones. With early diagnosis and proper treatment, animals with Addison's disease can live a long and happy life.